Welcome, I'm Jason Matthews and we're here today with Dr. Wilson of UAB Medicine. Welcome.
Thank you for having me.
Today we're going to talk a little bit about urology and the misconception that most people think that urologists primarily deal with male patients only.
That certainly is a misconception. In fact, we see many female patients because unfortunately they are at risk for having malignancies involving any of the organs of the urinary system. That would include the kidneys, the ureters, the bladder, as well as the urethra. Of course, female patients don't have a prostate, so we don't deal with them from the standpoint of that organ, but they also have urinary incontinence, UTIs, and blood in the urine.
And what types of problems do your typical female patients have?
Well, my practice is a little different from the typical urologist in the sense that I see primarily female patients because I do specialize in female pelvic medicine and reconstructive surgery. However, I do see patients with kidney stones as well as blood in the urine and urinary tract infections, but my preference is to see patients with pelvic organ prolapse or urinary incontinence.
And speaking of the pelvic prolapse, what are some of the common signs and symptoms that someone might find?
So many times patients will have incontinence as a sign of their prolapse, but oftentimes they will experience pelvic pressure or low backache, and these symptoms seem to be more obvious as the day progresses. And sometimes they may actually feel a bulge or something herniating through the vagina when they are using the restroom or showering or bathing.
So what are the treatment options for pelvic organ prolapse?
The treatment options really depend upon how bothered the patient is by the symptoms. So if there's minimal bother, we could actually do observation. And then we progress to possibly insertion of a pessary or surgical correction, which could be done through the vagina or abdominally through a laparoscopic procedure or a robotic procedure.
Well, Dr. Wilson, thank you for sharing all this information today. And if you're having any of these signs and symptoms, please go to uabmedicine.org.